Hi, my name is Thomas Mueller. I'm here to discuss the results from a large real-world study of the prostatic urethral lift. I need to disclose I am a paid consultant of Teleflex Incorporated, and this abstract was also sponsored by Teleflex. Now, comparing real-world performance of minimally invasive surgical therapies for BPH to outcomes from controlled trials can help elucidate their clinical applicability. And the prostatic urethral lift has been shown to deliver rapid, significant, and durable symptom relief with minimal morbidity in numerous controlled trials. Now, our objectives here are to expand the results from a large real-world retrospective study of the prostatic urethral lift and assess how outcomes compare with those from controlled clinical trials. What we can see is that what we have accumulated 3,226 patients that underwent the prostatic urethral lift in 22 US and Australian sites. Inclusion was just an IPSS pre and post urolift procedure. We do include retention patients, which was not considered in previous lift studies. We looked at IPSS, quality of life, Qmax, adverse events throughout 24 months, symptom scores between retention and non-retention patients, and then we did compare our results from this trial to the lift randomized control study. Lastly, we looked at specific subgroups, one being prostates greater than 80 grams, age less than 50, obstructive median lobes, and patients with prior radiation therapy. Now, what we found is that from a safety perspective, the most adverse events were mild to moderate, resolved within 4 weeks. What we could see is that compared to the lift study, people were slightly older. The prostate size was fairly equivalent. IPSS was not quite as bad. Quality of life was not quite as high. Qmax was a little bit higher on the real world study. The number of implants was approximately the same. Now, what we found in certain subgroup analyses that patients with greater than 80 grams, these larger prostates were safely treated and experienced symptom improvement with the UroLift or the prostatic urethral lift. No difference in symptom response was based on prostate volume. Now, obstructive median lobe subjects experienced significant relief throughout follow-up, 46% improvement at 3 months. There were no elevated rates of adverse events compared to non-obstructive median lobe patients. Previous radiation improved significantly at 1, 3, and 6 months. PSA was not elevated throughout the follow-up compared to non-radiated patients, and there was no significant increase in incontinence, urinary tract infections, urosepsis, or urethral strictures compared to non-radiated patients. Lastly, both younger, less than 50, and older, greater than 50-year-old patients did have significant improvement from baseline throughout follow-up, and the adverse events were not elevated in the younger patient population. If we compared the real-world study, patients with baseline criteria which matched the lift study, they experienced symptom improvement that was consistent with that of the lift study, as you can see in this nice table. IPS scores for non-retention patients improved significantly from baseline at all time points, and the non-retention and retention patients had comparable IPSS symptom response across all time points. So in conclusion, what we're able to find is that with the real-world study, it's the largest and most comprehensive evaluation of a minimally invasive BPH procedure in a real-world setting. These expanded results, what they do is they demonstrate that the prostatic urethral lift and its outcomes and rates of adverse events in the real world are consistent with those seen in our lift randomized controlled trial. And lastly, what we can conclude is that the prostatic urethral lift has broad applicability to safety, and as well as it effectively treats BPH patients in the real world, including those subjects that are younger than 50 years of age, those with larger prostates greater than 80 grams, patients with obstructive median lobes, as well as patients with previous radiation therapy for prostate cancer, and patients with a baseline urinary retention.